Let's talk about stress. And we're going to talk about the professions out there that are very, very stressful and can create a lot of problems, not only for the short term, but also for the long term. What is it going to be doing to your body? Do you know how to handle stress? Do you recognize the signs of stress and what you can do to alleviate it? It's almost like a building block effect that stress will lead to one problem, then it leads to another. And medically, it can be very complicated. And on board, I've got cardiologist Dr. Fahmi Farah. She's a medical expert, cardiologist based in the Dallas-Fort Worth area. And we're going to talk about ways to balance that stress. And, Doctor, it's really great to have you back on radio. You are live with us. How are you today?
Hey, it's great to be back. I'm doing well. How are you?
Doing great. Thank you for joining us on the show. And we're going to talk about the compounding effects of stress on people's lives, and there are a number of professions that do experience a high volume of stress, but a little background about you. Tell folks what you do, and we'll take it from there. Welcome back.
Sure. Well, I'm an invasive cardiologist. I see patients with various different types of heart problems. I'm also the CEO and founder of Bentley Heart here in Texas, Dallas, Texas, and the director of Global Health Alliance Foundation.
Okay, absolutely. And, you know, when you look at the idea of stress, it's not just an idea, it's a reality for millions and millions of people, right? It's not something you read in a textbook, but it really impacts folks directly. Stress can be quite debilitating unless it's handled properly, right?
Oh, absolutely, yes. Stress can be debilitating in many aspects and definitely has an impact on your heart health.
Yeah, and do we find it simply this is just going to be the day and age where folks are going to be stressed out due to work demands? Like, for example, maybe a stressed out male worker or female worker feeling underappreciated could have maybe twice as likely develop, say, potentially deadly heart disease. And things like that. There are studies out there that I would imagine reflect that, the underappreciated worker.
Yes, there was a recent study done actually that just got published by American Heart Association in Circulation that addresses that very question you're asking.
Okay, and the study I was looking at found that those men who struggled with one or more issues with stress maybe saw a 40% increase in the risk of heart disease as compared to those who didn't report any of those kind of those stressors. We hear the term, doctor, heart disease that is tossed around quite frequently in the media. A lot of stories out there about heart disease and way to stop it. What exactly is heart disease? How would you explain that?
Very good question. Yes, heart disease is a very broad term. It's an umbrella under which there are various different types of conditions. One of the most feared one, of course, is heart attack, which stems from having blockages in your heart, which is also known as coronary artery disease. So basically, it usually happens, the blockages form over time, and many factors play a role in it. For example, your lifestyle, like, you know, how healthy of a diet you have. Are you exercising? Unhealthy habits like smoking, drinking alcohol, all of those will contribute. Stress definitely is a factor. It is a risk factor. There are other risk factors as well. People who have high blood pressure, high cholesterol, diabetes, those are all risk factors that accelerate this process of plaque building and developing coronary artery disease that can ultimately lead to a heart attack. So people who have coronary artery disease, meaning like have existing blockages in their heart, they may have symptoms that they're unaware of, subtle symptoms like fatigue. They just won't be able to carry out the same level of activity, and endurance won't be the same as it used to be at one point. And it happens gradually, and sometimes it's what keeps people from realizing because their new baseline becomes something over time, and they consider that is their baseline, so they kind of ignore these symptoms. But when it gets to a critical level, like if the blockages are significant, then people will start to have more pronounced symptoms like chest pain, shortness of a breath, it'll be evident in their day-to-day life. They should definitely seek help, of course. But then a step further from that is a heart attack. And a heart attack happens when, when we have blockages in our heart, the blockage actually is called it's a stable blockage, so it actually stays within a capsule, so to speak. And in the event of a heart attack, that ruptures, that capsule kind of ruptures, and the content inside the blockage kind of just abruptly gets out, and it blocks up the entire system, that entire area of the artery. And so no blood flow will happen at that point. It's 100% stop to blood flow, and that is the definition of a heart attack. And when that happens, it's very lethal, it's deadly, and so time is life is what we say when it comes to heart attack. It's very important for you to seek help immediately and get treatment immediately, because otherwise it is life-threatening.
When you mentioned the blockage that's going to be going on to the arteries, do you normally treat that, say, with a chemical regimen, say with prescriptions, or does it get down to maybe an ablation in the heart to try to alleviate those concerns? Multiple approaches, I guess, right? Varies between individuals.
There are several different approaches. So, for example, in the setting of an acute heart attack, we take that patient to the cath lab. We go inside and we intervene. We actually put a stent in there, and we open up that blockage, and we restore blood flow, and we basically restore life, so to speak. That's in the acute setting of a heart attack. And for, chronic setting, yes, there are medications that we provide to our patients depending on what condition exactly they have, what their risk factors are. So it's very much individualized based on the individual and their risk factors. And so the medications, we have great treatment strategies, so we can actually prevent a heart attack. We can prevent, really bad things from happening because medication and treatment strategies are just that good. So it's all a matter of coming to see your doctor in a timely manner and following those instructions.
What's amazing is the technology that is going to be available out there in the field. Say somebody's under stress, has a heart attack. I've been told by the folks at MedStar in Fort Worth that they have got the ability to be able to communicate directly from the ambulance right onto the emergency room. And then the emergency room is then able to set up a treatment plan or a regimen even before the ambulance arrives at the scene of the hospital. So the technology today, as compared to maybe 10, 20 years ago when you were first getting into the medical side, it's like night and day, right? More lives are being saved these days with these regimens.
Oh, absolutely, yes. The advancements are incredible. We have the ability to treat people, so as you mentioned, it's correct. Whenever there's a massive heart attack, the EMS service informs the hospital, and there's an emergency line for that, a specific team that's dedicated to take care of that heart attack patient. So before even the patient comes to the hospital, an entire team is already waiting for the patient, not just in the emergency department, but also in the cath lab, where the cath lab is already prepared for this patient, so that we're just trying to reduce the time as much as possible to save this person's life, and not only to save the life, but also prevent comorbidities and complications down the road. And the sooner you fix the heart attack, the less likelihood of complications down the road. So it's not just saving life, but it's also making sure that that patient's going to have a quality life.
Drivers, I'd love to get you on board. If you got a question, we're talking about stress and ways to alleviate stress out there on the road. You got one of the most stressful jobs out there on the road today. Ladies and gentlemen, Dr. Fahmi Farah is on, and she is one of the nation's best cardiologists, talking about ways you can alleviate stress in your life and, avoid complications with the heart. Are you under stress out there? I bet you are. What do you do to alleviate that stress? What do? Do you exercise or try to get plenty of sleep? You got to do that. That is such a critical thing. Give us a call. We'll put you on the radio with Dr. Fahmi Farah. Doctor, again, thank you very much for joining us on the show. In a case like this, with the audience that you're talking to, mainly over-the-road truck drivers, they're out there all the time, cross-country, North America, sea to shining sea. And many may not have the opportunity to be able to get into a doctor at their convenience due to their driving schedule. So would you recommend they find the time somewhere, somehow, to get a stress test done so they know what their risks are and maybe talk with the doctor directly and get on the right track? Find the time, right? What do you think?
Finding the time is, of course, crucial. Your health comes first, especially your heart health, because that's life. And I will say, going back to technology, it's so easy now. Like, most cardiology practices will provide some form of telemedicine opportunity. So I can't say that you need a stress test without knowing what exactly you need. So really the first step is to talk to the cardiologist. It's a consultation. You'll tell them all your history. They'll get a thorough history from you. And based on that, they'll formulate an individualized care plan. Whether it is a stress test or an echocardiogram or a simple EKG, it'll all be determined by the cardiologist based on your individual, story. And so that consultation is the first step, and that can happen honestly from anywhere. It could even happen while you're driving. I'm not trying, do it safely. Don't do it while driving. Pull over. But all I'm trying to say, the point of this is that it's very much accessible now, regardless of where you are at. And talking about me, my practice, for example, I provide care to, even though I'm located in Dallas, like, I have international patients, for example. I have patients that fly out to me from Hawaii, from other countries. It's because we're able to provide that telemedicine care, and then we formulate a plan for them where they'll come in and do all their testing. They'll just take, a couple of days off. They'll just come and do all of their testing, and then the rest will be done by telemedicine. So it's not like in the old days where you would have to physically be present to receive all the care. That's not true. We can individualize. I know my practice does that, and I believe many other practices do that too.
All right, let's go to the phones, and a number of questions have come up, and that's great. We're going to go first up to Dan, the driver, and just want to make mention that the doctor is not here to diagnose you over the phone, obviously, but to give you the medical information you need so you can take it back to your own physician. Dan, welcome. Question for the good doctor.
Not a question, just weighing in on how to alleviate stress. I'm 61 years old, been driving for 43 years. I ride a bicycle about 125 miles every week. I unload my own truck. You got to keep moving. That's all there is to it.
Keep on going, right? Don't sit still. And
exactly.
That's an incredible number of miles that you're on that bike. And we're talking about really great physical workout from your heart, exercising your muscles. You probably feel great. Am I right?
Yeah, for a 61-year-old guy that's been trucking 43 years, yeah. I think the mortality rate for a truck driver is age 61, and I'm fighting it tooth and nail here,
Yeah. Well, what does your diet consist of? I'm just wondering. What are you eating?
I don't know. Just, I eat protein, chicken, just, normal stuff. I don't really have any crazy diets or anything. I just keep moving. Yeah.
Just do it. Yeah. I understand. Absolutely. That is one of the keys. Right, doctor? Don't sit still. The drivers you're talking with are normally under like an 11-hour driving day, 14-hour duty cycle, and they're stationary most of the time. They're just driving, sitting for long stretches.
Absolutely.
What are your thoughts? What are your thoughts on what he's been?
Yeah, I completely agree. Thank you so much for coming and letting us know about your activity. Absolutely agree. Sedentary lifestyle and inactivity in itself is a risk factor for coronary artery disease, and not just coronary artery disease, like so many other types of disease processes in your body, increasing risk factors like diabetes, high cholesterol, hypertension, all of those. So inactivity is a risk factor. Movement is key. It's simple, but it cannot be underestimated how important it is to exercise and just move.
I appreciate the call, driver. I got to go to the break here, but thank you for sharing that. And maybe it can be summed up as simple as that. I know it's just keep moving. I know there's a lot more to that. And we're going to cover a lot more ground talking on the program about heart health and medical awareness and the idea or the reality for many of you that stress, man, it is out front and center. It's with you in the morning until you go to bed at night. What do you do to handle that stress? What do you do? Do you bike? Do you have a bike on that truck? Do you walk a lot? Do you have weights on that truck? Many of you do. I know that for a fact. And how does that help you alleviate the stress? Dr. Fahmi Farah is on, one of the nation's best cardiologists, and we're going to get back to more. Everybody goes through stress. Everybody. If you say to me that you don't have any stress in your life, I'd probably rethink that statement. You may handle it well, but you've got a lot of stress in your life. You've got to be able to know what to do with it. And there are a number of jobs that are out there that are just stress-laden. They've got stress written all over it. For example, bartender, according to this list I've got, teacher, sports referee, a chef, a social worker, a broadcaster, reporter. Yep, I can vouch for that. Paramedic is going to be another one. And, Doctor, thank you for joining us. And what I'm not seeing on this list is truck driver. And they should be on that list, right? Very stressful, very hectic job and lifestyle for the drivers.
Yeah, I'm also surprised that doctors are not on that.
Yep. Well, it does indicate that, folks have got to know their limitations, that if they're feeling overwhelmed, stress is part of their life right now, you got to find ways to maybe get some relief, turn off the noise, maybe exercise more, yoga, that kind of a thing. But is stress on the other side of the equation? Can it be a good thing in some cases? Can stress be a good thing or have some attributes?
Well, evolution would say some amount of stress is necessary because it saves us from, disasters. But for our purposes, for the purpose of this conversation, no, stress is actually not a good thing for our body overall. Too much stress is definitely not good because it is directly linked to cardiovascular disease and all sorts of risk factors. Stress will increase the risk of your high blood pressure, cholesterol, diabetes, like all of that, and ultimately heart disease.
Okay, and when somebody is undergoing those kind of regimens like you're mentioning, like diabetes, for example, can that increase, can a pre-existing condition maybe increase the chances for, say, a heart attack, more stressors, things like that? Can that contribute to the problem?
It certainly can, yes. Stress is something that can precipitate a heart attack, yes, enormous amount of stress. There's other things as well. There's something called stress-induced cardiomyopathy, which is a type of heart failure that happens as a result of directly related to stress. It's also known as broken heart syndrome. It's evident in male and female. It happens in, really tragic conditions, loss of a loved one, or, it doesn't have to be a loss of a loved one. It's just, enormous amount of stress, acute stress that's happening in an unexpected sort of a way. So we do know we've known this for quite some time, that stress has a very negative impact on your heart health.
And when somebody's going through all those different things like you're mentioning, say like the loss of a loved one, creating stress and causing cardiac conditions, it is important to maybe go talk that out with somebody, either a counselor, maybe try to find ways to alleviate that stress, but then combine that with the medical side of the equation as well. It's got to be maybe a dual approach when handling things like that, say the loss of a loved one, stress, and then any subsequent cardio condition or cardiac care condition that might develop.
I agree with you. I think stress management, it's easier said than done because, life happens. We all have stressful events in our lives that are often not in our control, relationship issues, that's not in our control. Job issues, sometimes that's not in our control. So when it comes to stress, I think the reason it's so difficult to manage stress is a lot of times it's stuff we're dealing with that's not in our control. So things that are outside of our control tend to stress us out more, right? So I agree that it needs to be an approach by multiple people, so to speak, like, of course, seek help from your doctor, but you also need to take some authority on your own, find things to alleviate yourself from those stressful situations. Just detach yourself, like, exercising, finding meditation. Different things work for different people. Counseling, seeking counseling is extremely important.
All right, very good. Doctor, I'm out of time. I got about 30 seconds left. One more time, where can folks find you on the web? What's the best way to reach out with questions? One more time.
You can find me at drfahmifarah.com, on social media at Fahmi J. Farah on Instagram and Twitter.
All right, very good. Thank you, Doctor. That's Fahmi Farah on board, cardiologist in the Dallas-Fort Worth area, one of the nation's best. And that's it. Music means I got to wrap it up. If I don't wrap it up, it's going to be stressful for me. So I'll see you tomorrow, drivers 2 Eastern, right here on SiriusXM 146. Have a great night.